if I could introduce you to the panel. Morning, everyone.
Hello.
We've got,
Morning.
I'll go around the room first of all. We've got Simon Cuthbert-Kerr, who's Deputy Director for Improving Standards and Quality, the Director of Social Care and the National Care Service Development from Scottish Government. Welcome, Simon. We've got Claire Cairns, Director of the Coalition of Carers in Scotland. Hi, Claire. And we've got Ian Thomson, who's Head of Service Quality Assurance Adult Social Care NHS Highland. Thanks for joining us at such short notice, Ian. Ian's got a really unique perspective given the development of the local self-directed sports strategy in Scotland, in Highland rather. And we've got Jane Kellock, the Project Manager's Consultant, who you met already from Social Work Scotland. Hi, Jane. Okay, I'm going to kick up. Well, what we did was we wrote out to everybody and they submitted a few questions. So we've got one specific for each of you and we'll throw it open to everybody after you've given your answer. So Simon, the first one I've got for you is from Jim Elder-Woodward, and he's saying, the National Care Service will foster a human rights-based approach to service provision. How will the SDS improvement plan meet that objective, and how will such an approach be measured?
Thanks, Donald, and thanks, Jim. So I think I would say that sort of high level, the improvement plan is ultimately about making sure that people are offered the full choice and flexibility through SDS, which they're entitled to. So on that very sort of high level basis, I think that anything we can do through the improvement plan to deliver that inherently supports a human rights based approach. But I know that the reality is actually a lot more complicated than that might sound. So in terms of what's happening with the NCS, there's clearly a lot of work being done to clarify exactly what that human rights approach will be. So for example, there's the second phase of co-design of the Charter of Rights and Responsibilities. So what we're doing with the SDS improvement plan is very much intended to support and be coherent with that work that's been done for the NCS. So just to take an example of the 4 outcomes of the plan, supported person and carers' choice and control over their support, enhanced worker skills, practice and autonomy, systems and culture, and leaders understand and help staff realise SDS principles. And I would say that each of those 4 outcomes has a clear link to supporting and realising people's rights under the SDS Act, but also human rights more generally. There's a consensus from the national collaboration to list the outcome on supporting people's choice and control as first and foremost amongst those, as a real signal about the primacy of that. So I think improving how that is delivered needs very much to be at the heart of our approach to SDS, and in doing so, that should reflect the human rights-based approach. I think also it's worth pointing out that the plan recognises that human rights are very much foremost amongst that golden thread identified in the plan. On Jim's question about measurement, I think it's always going to be a challenge to establish the extent to which activities lead to the realisation of human rights, because in some senses it's quite an abstract concept and not necessarily an easy thing to pinpoint. But one thing we are keen to do that wasn't in the previous plan is to set out a monitoring and evaluation plan and agree through the national collaboration that those measurement efforts are person-centred, appropriate and meaningful. And I was struck by something that Sarah Anderson said about being ambitious. And I think that applies to our ambitions for how we measure the outcomes of the implementation plan. And just because, measuring the human rights approach is difficult and complicated, we shouldn't shy away from it. We need to be ambitious in how we understand how we're realising that. And again, to sort of lean on Sarah's excellent presentation, I think there's a real opportunity for us to work again with people who have lived experience to understand what would be meaningful for them, for us to measure, to indicate the extent to which we are taking a human rights approach. And so ultimately, I think if everyone is able to access the full range of SDS options in a consistent and flexible way, that's a major element towards taking a human rights based approach. But I'm really keen that as the implementation plan is delivered, that we really make a good fist at understanding what that means and that we can really evidence that in people's experience. Thank you.
Thanks, Simon. There's a lot to unpack there. I think it's good to hear that we'll explore further how the plan will be measured through the national collaboration. Can I throw open to anyone else who's been involved, Jane or Claire? You've been involved at points with the development of the National Improvement Plan. Is there anything you would want to comment on in relation to that human rights-based approach and how the plan should be measured?
I can come in a little bit if that's okay. Yeah, so the national care organisations, we did put in a response to it, and pardon me, I've got a bit of a cold. And we kind of recognise, firstly, that obviously it's quite high level at the moment, and you are going to be adding in actions and timescales and so on to it. But we did feel that there were a few areas where it could be strengthened. I think, firstly, around the outcomes, the supported person and carer's choice and control. I think it could be strengthened maybe by mentioning specifically human rights and changing lives within that outcome. And also putting it up to being number one rather than the last one, because for me, I think that's the most important aspect of it. And I think maybe throughout the improvement plan, it could be strengthened in terms of reflecting, lived experience, supported people and carers' involvement in it. For example, it doesn't mention the phrase carers as equal partners at all throughout it, which I think it really needs to. That would strengthen it. And then the one other thing I would say is that it could do with an additional outcome. I know it's already been mentioned today. I came into the meeting late, but I did catch the tail end of the last presentation, and just about needing to increase the marketplace and the variety of support available to people. We know we've got real difficulties with that, with workforce and so on. And so I think that's a really important outcome, is to look at service availability, and you can only get choice really if there's services in your area that you can choose from. So I would suggest that needs to go in as an outcome as well.
Absolutely, Claire, thanks for that. A huge difficulty. Ian, did you want to come in there? And then Jane.
I wanted to just come in on evaluation. I think it's a really interesting question, how we measure the success of the work that we're doing. But I think we can often make it a really tedious, bureaucratic task. Actually, I think if we can engage people in trying to answer, tell us how you think, what would tell you it's working? So I think Simon's right, ask people themselves, people with lived experience, what would be the markers? What would you tell you that you think things are working? That's quite an interesting question. We could explore that in quite an interesting way. We seem to turn these things into kind of quite convoluted, quite laborious evaluation exercises, but actually it's a question, it's an interesting question, and if we can get people to engage in that, we might come up with some kind of elegant ways of trying to answer it, I fancy.
Great, thanks Ian. Jane, do you want to comment on that part?
Yeah, thanks for mentioning the evaluation work. Ian, Highland are going to be helping us to test out an approach to undertaking a learning-based evaluation, which I think is fundamental actually to human rights, because if all you're doing is evaluating against something and measuring some form of performance, then there is no room in that really to make the brave choices and changes that you need to make the systems work for supported people. Measuring performance measures, it sort of assumes that the system that you've got can actually produce the goods, and I think we all know that that's not the case. So absolutely a learning approach to evaluation, and also stopping to have over-reliance on quantitative information. It really doesn't tell us anything about human rights. So we need to build in the routine gathering of qualitative information, and of making sure that supported people have a much easier way of making their voice heard, both locally and nationally, in these change processes. The other thing I wanted to mention about human rights is the approach that we want to take to the review of the SDS standards. So we're looking principally at that from an equalities impact perspective and also an islands impact perspective, but not entirely using those methods which we know can be a bit flawed. But we are wanting to look at it from an equalities perspective and to redesign the standards such that the core components are much more aligned to what supported people should expect under their human rights to be the case with SDS. And then we'll look at what does it take to deliver on that. So we'll look at the behaviours of people, workers, actors within the system, finance, etc., to say this is what we think you need to do in order to help to meet the rights of supported people. So that the systems do the heavy lifting, and it's not always down to the supported people when they get a bad service to voice their complaints and their issues into a system that is incapable of change. So we're really wanting to drive forward the learning, systems being learning mechanisms, everybody in them leaning into the rights of supported people. So it's a bit about the culture of change as well, I think. Thanks.
Thanks, Jane. Really thorough answers. I hope that helps you answer your question. Jim, Bex, could I hand over to you?
Yeah. For the next question, it would be really interesting to hear initially a perspective from Simon from a national perspective, and then maybe from Ian with more of a local focus. So it's a question from Jane, and Jane's question to us was, how can we achieve and sustain improvements to self-directed support given the current social care crisis? So Ian, if we could hear from you first and then Simon.
Okay, well, I mean, I think it's trying to get the right help at the right time and in difficult circumstances. And I think that's around about how we go about trying to procure care as best we can and support and the type of help that people make their options and their outcomes realised. So I think I'm no expert. I'm probably the opposite of that. I'm not always understanding the commissioning and contracting approach that we take. It seems to me that we have set up a set of rules that are self-defeating, and we also often have a panoply of resource allocation stipulations and rules that seem to cut our nose off to spite our face. It seems, I think, that we need to try to work with everybody who's across the system and across sectors to try to build trust. And to try to make sure that we can get a flexible set of responses. What we do at the moment, it seems, is try to manage demand. We try to standardise provision, and we try to achieve lowest costs across the system. And that's in part in respect to the financial pressures we pay. But I think we've been trying to manage demand for a long hour challenge, certainly in having some of the challenges within the system is about stimulating supply. So we really need to change our angle of attack. And what we really need to do, I think, is to try to stop pretending that we can manage the market in some kind of old-fashioned Soviet way, where we have all these planners, but in fact allow people to work within the market, allow people to be flexible. So if you have workers and individuals who have ideas of really what they want from life and what would help their situation, given the resources, giving them the flexibility to try to realise that, I think is there. So we operate in a dynamic world. We operate in one where prices are going up, where the price of labour is going up, where the supply of care has gone down, and we're asking people to try to mitigate circumstances. So we need to untie their hands and allow them to try to do that as flexibly and ably as possible. I think that therefore we really need to try to make individuals as close to the point of commissioning as possible. I think we really need to help them make the decisions around about the care that they want, and they have to live in the real world, the care that's available. We're seeing the tide going out in traditional care. It's really difficult. That is a proper challenging situation. So we need to untie their hands and give them as much flexibility as possible. So a few examples in Highland is that we got resource from Scottish Government around about extra support for short breaks for carers, and instead of us trying to commission that, we really just put that in the hands of carers themselves. We trusted carers. We would give them an option one, let them spend the money. It's in their interest to give themselves a break, and we didn't really try to police that particularly. We just tried to let them do that want to increase worker autonomy. We have almost no worker autonomy in terms of resource level. We need to have that. So we're trying to trial and increase the opportunity to workers to immediately bring resource to those that they're supporting, and try to get more flexibility in and around about the market. So we're trialling ideas, I think, hopefully soon, about self-directed support agreements that would be with providers, with individuals from the local authority, but really trying to make sure that that's not a limited framework of providers, and stop thinking necessarily about care in terms of care providers, but just think about what do people need for the life that they want to live, what will meet their outcomes, and how do we go about purchasing that. So that's one of the things, and I think another element that we're trying to do is to try to engage communities in really difficult circumstances, and to say, right, okay, there's quite a significant amount of resource tied up in supporting things that aren't working. We were out in West Ardnamurchan talking to folk there. Really difficult again to get care, but we're tied up. We pay high agency rates, and it's not working. So what would work? How could we try to find local solutions to local situations? I mean, they're not quite an island, but they're almost an island, and the answer needs to be found from within the communities that you're living in. So how do we stimulate support? How do we stimulate care? And how do we provide options to people? I answer that much better than we do, and it's really around about saying, okay, well, let's try to co-produce a few solutions. There is resource available. We're probably misdirecting it. I'm sitting in Inverness and I actually don't have a great clue as to what's happening in Ardnamurchan. You do. How should we be spending our money, and how will we have a shape of care going forward that was going to try to allow people to live their lives and actually have their deaths locally? That's the kind of thing that we would like to do. So I don't know if that answers your question, Bex, but that's the best fist of it that we've got, I think.
Ian, thanks. Simon, I don't know if you've got anything to add to Ian's words from a national perspective.
I mean, I think a lot of what Ian said is spot on. I would add that I think that there's a real sort of paradigm shift needed, to rely on a slight cheesy cliche. Ian sort of touched on that about changing how care is delivered, but also changing how we understand care. For me, SDS is right at the root of how we deliver social care in the best possible way. All those words about control and flexibility and choice. To me, that's the argument for making sure that we are achieving and sustaining improvements, even in the situation we're in, because SDS is an investment. It's an investment not just in people, but it's an investment in the contribution that they can make to their society, to the workforce, to all sorts of things. So I think we really need to display as well as we can the massive benefits that people achieve through SDS and all that means for the entire country. So I think that's one of the things we will be doing from the improvement plan, because actually I think that's one way that we tackle the crisis. We reimagine how we deliver care instead of relying on things that might have worked in a different context, might not be working so well anymore, and actually really use SDS to empower people, but also really to sort of strengthen the sector as a whole.
Shall we move on to the next question, bearing in mind the time?
Okay, there's a couple of comments came in, but I'll maybe read them at the end. There was one question from Dawn Ranson that came in. Claire, I was going to direct us towards you. Dawn Ranson's an unpaid carer for 2 people, and she's saying, I'd like to ask why informal unpaid carers don't receive SDS budgets in their own right, and how the uptake could be improved. And similarly, Kim Anderson from Angus Council commented on our work within children's services. How can we ensure that parents feel supported in their caring role, even though there's no budget allocation, when a parent feels that it might be essential for them?
Yeah, thanks for that. Thanks to Dawn and Kim for those questions. I suppose firstly, to sort of answer Dawn's questions, why aren't carers accessing direct payments in their own right? I suppose the simple answer is they should be able to do that, but we know uptake's very poor, and it's a bit like a lot of different areas of the social care system. It's not working the way it should do at the moment. I mean, the right for carers to access direct payments came in with the SDS Act and then was strengthened through the Carers Act, which is now almost 5 years old. So it's been around for quite a while. And in a nutshell, when carers receive support, they have the right to the 4 options in the same way as a supported person does. But if we look at maybe why it's not happening, why carers aren't being able to access a direct payment, I think it's a few things. I think, first of all, I'm not convinced that all practitioners are aware that carers can get a direct payment in their own right. And I think there needs to be better awareness around for staff around carers and their rights. And we also know from work we've done that carers aren't always aware fully of their rights either. We did a survey a couple of years ago asking carers this, and only 22% who responded were confident that they knew about their rights. We're about to repeat that, so we hope to see an increase in more people being aware. But if they don't know that they can access a direct payment, they're maybe not coming forward and asking for it. In addition, not all carers are getting an adult care support plan, which would be their route to get a direct payment. Only about half of carers who are in contact with their local carer centre have had an adult care support plan. And I'm sure they've been offered it. It may just be that they're not taking it up and they feel it's a bit of a bureaucratic process. There's probably lots of reasons for that, but perhaps that starting point needs to be looked at. And also carers, the eligibility criteria for carers to be able to access a direct payment is still very high. So most carers, even with an adult care support plan, won't meet it. And then even carers who get through that whole process, very often their support is added to the supported person's budget, which can work well sometimes. But what we often hear is because, you know, that resource is finite, very often rather than taking a short break, carers will use it for the support of the person they care for rather than taking the resource for the break themselves. So in many ways, I mean, part of the Carers Act was for carers to have support in their own right. And so we would like to see that happening more. I don't know of information available on how many carers have got a direct payment in their own right. That's maybe a piece of data that's missing. I know the carers census looks at what support carers have taken up. And from that, we know that about 37% of carers who have had an adult care support plan will access a break. But we don't know the delivery mechanism and how many of those carers would then have received a direct payment. I suspect a lot of that will be more things like the Time to Live Fund, where it's kind of a one-off grant and it's not a direct payment, which is a sort of larger package. And I suppose the other thing I would say that as we move into a right to breaks from caring through the National Care Service, all this is ever more important because it'll be the same system and mechanism for carers to be able to access that right to a break from caring and potentially to get it delivered through a direct payment. So we need to make sure the systems are operating correctly in advance of that coming in so that carers can access it and access it in a way that gives them full choice and control. So that's kind of the answer to Dawn's question. I suppose Kim was asking something a little bit more different in terms of, but related. So in terms of children's services, if people feel they need the support, how can they get support if they're not actually getting a package? And again, I would start off by saying it's well worth them having an adult care support plan and checking out firstly, do they meet eligibility? Is it something they can get? And if they don't, then there is a variety of ways they can still get more universal support. So the first thing very much we would always say is go to your local carer centre because they're often a hub for carers receiving that kind of support, or go to other third sector, maybe condition specific organisations. And then that means they'll be able to access things like peer support with other carers, but also the grants I mentioned, the Time to Live grants or the Family Fund as well. They don't require you to meet any eligibility threshold. So that's something that people should be directed towards. And also, I think, you know, from the other side as well, in order for people to feel supported, it's also about practitioners making sure that they understand that carers are equal partners in care. I think that goes a long way to making people feel supported when they feel that their needs are recognised and they're part of a team. And when it comes to any form of assessment or care package being put in place, that they're very much considered as being a vital part of that.
Thanks, Claire. I'm going to come to Jane in a minute to see if she's got anything to comment on that. But Dawn's put a comment in the chat saying, thanks, Claire. It's really helpful. I think it's about ensuring both Health and Social Care Partnership, social work staff, carer centre and informal carers are aware of their rights. I agree about the data being needed, so important it gets out there. Jane, surely this is, resonates with some of the conversations we've had about an informed workforce.
Yeah, definitely. We know that the workforce, the social work and social care workforce, hasn't necessarily got the awareness that it needs to have. I'm sorry if you can hear my dog in the background, but she won't shut up if somebody's at the door. So we know that there's a lot to be done there, both in terms of awareness, but also in terms of the training of the social work workforce. And we can see deficits in training offers, particularly around the kind of skills-based training that we think social workers need to be able to confidently offer SDS across all of the care groups. Just to say as well, one of the first things that we're going to do with the standards review is to make sure that the standards speak for carers and for parents as well as for supported people. And we recognise that there's a gap there and there's a miss with regards to how relevant those standards look and feel for carers. So we will be definitely coming to Claire in the future and to others to have that, to put that kind of lens, if you like, over the standards to say what do they need to say, what are these core components, which is what good SDS looks like, what should they say in relation to carers. And we know that the standards are a useful basis for workers and for everybody really who's accessing the SDS systems. So that should be that first stage of saying, like, the standards say this is what good looks like in terms of carers accessing SDS. So that's our kind of starting point to make sure that is laid down as the basis, the benchmark, if you like, for what good looks like. And then we can build on that in terms of how we think workers need to address that. And then we can offer practice guidance and we can offer tools and we can offer links and we can kind of link people in to the systems. And when we begin to look at how we develop good quality training for social workers, we need to include that in that training package as well. So yes, a lot to play for there.
Great, thanks Jane. Now we're rapidly running out of time, but I'm going to hand to Bex for the last final question.
Yeah, and bearing in mind the time and the fact that everybody's going to be wanting to get their lunch, the last question is around how can we improve on collaboration to help us work. Is that the right question? Are we asking? Yeah. Sorry, beg your pardon, everyone. We've skipped a question, so ignore everything that I just said. This one's for Ian, but if other people have got other things to add in a few words, that would be great. We understand that you have been exploring how to move from competitive to collaborative commissioning. How have you found this?
Okay. Well, as I said earlier, I mean, I'm not any expert in commissioning. It's quite the opposite. But really, it's around about, I think, much of it is in the same way. It's about collaboration, it's about working together, it's about building relationships, it's about beginning to trust people. We've set up a competitive system, haven't we, where we don't trust people, and that's been the nature of care management. So care managers need to do reviews, they need to make sure the providers are providing the hours. We won't trust them to do that, so we'll need to have contract monitoring, and we'll need to have a variety of different social worker reviews, etc., etc. And really, I think what we need to do is change the paradigm, if Simon wants, again, and say, no, let's get a system where we do trust each other. Let's get a system where we can make sensible decisions that are not based on necessarily competition, and let's have a situation where we try to act collaboratively and see providers and service users and carers and ourselves as just simply part of a flatter structure where none of us have got a monopoly on knowledge, where there's not a hierarchy of knowledge, but we trust each other to try to work together and make the most of have. And I think that's the starting point for commissioning. Not we will get the best price and we'll put out a certain number of lots. Let's sit around the table, let's work out what we need and what's possible, and have a realistic look at to what's around and how we make the most of that, rather than saying, oh, well, you can't provide that care because you're a housing support provider and we've just assessed that person needing care at home. It's nuts. We tie ourselves in absolute red tape, and all we do is serve to trip over ourselves. I think that answer's just killed the questioners, by the way. Oh no, they'll come back.
Come back to life, because we need our lunch. Thank you very much for that answer, Ian. That's really helpful, really useful insights, and I think just summarising that honest approach that we all need to have to making things as flexible and as person-centred as we can for everyone.
Okay, thanks very much everyone for your time today and your input. I'm sorry we've not got to all the questions today, but you gave such thorough information. It was really interesting.